morning everyone. I am Shanti Bariga, a BSN1 student from the University of the Visayas, and I will be performing or administering parenteral medication. So, we will be doing first the preparing medication from ampules. So, the first step is to perform hand hygiene and observe other appropriate infection control procedures. This is to reduce the number of microorganisms on the hands. The next step is to prepare the medication ampule for drug withdrawal. Organize drug to be administered to avoid errors. We have here the materials needed. So we have an ampule of sterile water, a vial of sterile water, 3 cc syringe, 2 tuberculin syringe, withdrawing needles, a mask and a gloves to prevent the spread of microorganisms, and a medication tray so that the flow will be organized. The next step is to flick the upper stem of the ampule several times with a fingernail. This will bring all medication down to the main portion of the ampule. So the next step is to place a piece of sterile gauze between your thumb and the ampule neck. The sterile gauze protects the fingers from the broken glass, and any glass fragments will spray away from the nurse. So the next step is to break off the top by bending it towards you to ensure the ampule is broken away from yourself and away from the others. We should break the ampule carefully to avoid organic reactions that may give rise to injuries. So after that, we should dispose the top of the ampule in the sharps container. This is to prevent from getting cuts from any shattered glass fragments. After that, we should place the ampule on a flat surface because dilution dribbles out when the ampule is inverted, so make sure that the surface is flat. The next step is to attach the filter needle to the syringe, but before that, we will clean first the rubber. After cleaning the top of the rubber, we will wait for it to dry. A filter needle will reduce the chance of glass being introduced into a medication. So after attaching the filter needle to the syringe, we will now remove the cup from the filter needle and insert the needle into the center of the ampule. considered contaminated. Now, use of a needle prevents the accidental withdrawing of small glass particles with the medication. So, after that, we should withdraw the amount of drug required for the dosage. This is to abide by the 10 rights to prevent medication errors. Assuming that the doctor ordered me to administer a 1 ml of the medication to the patient, so now I will get a 1 ml medication for the patient. And after that, we should dispose of the filter needle by placing it in a sharps container. So we will get the cup, the safe use and disposal of sharps will reduce the risk of injury and acquisition of blood-borne viruses. So we will dispose this and replace the filter needle. Tighten the cup at the hub of the needle and push the solution into the needle to the prescribed amount. You should replace the filter needle and tighten the cup at the hub of the needle and push solution into the needle to the prescribed amount. This is to remove residue from the needle. Change needles after preparation and before administration. And now we will keep this because we will use this later. After performing the preparation from the ampule, we will now proceed to the preparation for the vials. So first, we should perform hand hygiene and observe the appropriate infection control procedures. This is to reduce the number of microorganisms on the hands. Since I am done washing my hands, we will now proceed to the next step. So the next step is to mix the solution by rotating the vial between the palms of the hands. Much insulin may not be mixed together, and this is also to resuspend the medication. And now we will place it in a flat surface. So the next step is to remove the protective cup or clean the rubber cup of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. It is important to clean the rubber cup to avoid contamination. So now, we will now attach a filter needle to draw up premixed liquid medication from multi-dose vials. Filter needles prevent the inadvertent administration of small glass fragments when growing up medications from a glass vial. So after which, we'll now remove the cup from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Before fluid is removed, injection of an equal amount of air is required to prevent the formation of a partial vacuum because a vial is a sealed container. So assuming that the doctor ordered me to draw a 1 ml of medication, I will also draw a 1 ml of air. After which, we'll now inject the air into the vial, keeping the bevel of the needle above the surface of the medication. The air injected to the vial will allow the medicine to be withdrawn more easily. Now withdraw the prescribed amount of medication, either A or B. A is holding the vial down, moving the needle tip so that it is below the fluid level. Vertical position makes removal of air bubbles from the syringe easily. And B, inverting the vial, ensuring the needle tip is below the fluid level, and gradually withdraw the medication. So inverting the vial prevents air from being aspirated into the syringe. After which, we'll now remove the filter needle and place the original needle. Before placing the original needle and removing the filter needle, we will place the cap. And after which, we will now appropriately dispose this filter needle into the sharp bin. And now, we are done preparing the medication from the vial and the ampule. We will now proceed to the next step.